So let me start. This meeting at the plenary, the virtual planning 16. We are in the blockchain applications in health working group. The agenda comprises a short introduction by me on blockchain basics and blockchain in health in this virtual session at the time of COVID. Question and answers afterwards, or maybe we can also put them all together in the end if when there is time. Blockchain and legal and regulatory issues within the General Data Protection Regulation by Ludovica Durst. And blockchain and COVID initiatives by Mirko Demalde. Mirko has become the health working group co-chair of the International Association of Trusted Blockchain Applications. And then we'll talk about next steps, because as I will show now, we have to postpone the conclusion of this working group to the next plenary. There is a delay in concluding the activities of the working group. There were a couple of online meetings before COVID broke through. Cancellation of the meeting scheduled in Melbourne in the spring. There was still an ongoing increase in the number of members of the working group. But again, this difficult situation because of COVID in the last months. And I could only profit of a useful initiative by RDA France, led by Isabelle Persey, who is also in our technical advisory board. And she organized this blockchain meeting on Atelier Blockchain pour la Santé on 21st October in France. But this also was virtual, but attended by more than 100 people. So coming to blockchain's basics very quickly. Blockchain is a disruptive innovation regarding uncertainties that traditionally have implied the need of relying on some amount of trust for coping with them. It is a technology providing transparent and secure storage and transfer of data without having recourse to a central authority. With blockchain, all data transfers become traceable and auditable by participants to the ledger. Blockchain allows to envisage a distributed rather than a hierarchical foundation of trust. It allows, as it has been said, trustless certainty. If internet has dramatically reduced transaction costs on information, blockchain can do the same regarding the exchange of data incorporating value. Blockchain allows to digitize value transfer and use self-enforcing smart contracts for automating the enactment of contractual rules. Code is low in blockchain. And blockchain allows to have recourse to issuing digital tokens for crowdsourcing. And this gives rise to the new area of what is called tokenomics. Well, in doing this, blockchain is introducing a substantial shift in the intangible economy. I have brought here an image taken from a National Bureau of Economic Research in the United States on digital innovation. Well, the characteristic element of digital innovation is the fact that digital goods are non-rival. You can have as many copies of a digital good as you want at no cost. So this allows for dramatic economies of scale, nothing which had been seen in this time before, because there is no material element conditioning the development of economies of scale. And this allows for, well, there is a cost of introducing the innovation, but once you produce it, there is no cost in replicating it. So this leads to a logic which was analyzed long ago by an economist called Schumpeter about a century ago. It gives to a logic to a winner-take-all market. The dynamics of winner-take-all market, because once you have acquired a leading position, then you can scale so quickly that this gives place to market concentration, and the competition is not in the market, is for the market. New market entrants can come because there are lower barriers of entry, but they have to be able to have a creative destruction innovation. And then if they achieve this, they can have market power. And this is a risk for those who had market concentration before, because this can always move. But this leads to the logic of establishing oligopolies and even monopolies in this area, and market rents. So in fact, you have huge profits because of this. And this is a consequence, has consequences on income and social mobility, because these market rents coming from innovation go to top executives, to key especially skilled employees at the top of the company, to investors. But there is very little return to labor because they don't have the capacity of negotiating about this. And there is an increase in social mobility. So in fact, the problems we are facing in these years of increasing inequality and of diminished redistribution come in part, largely from this characteristic of the non-rival nature of goods and how they develop a market which goes in this way with monopolistic outcomes. But in this sense, the blockchain is a really important innovation because it changes the balance between hierarchies and markets. What internet did to transaction costs regarding information, blockchain can do regarding trust. Transaction costs regarding information were reduced to almost nothing thanks to internet. And the blockchain has the same capacity for creating new ways of approaching trust. Reliable data-rich information systems become possible in blockchain without being paralyzed by excessive transaction costs. The limitation of decentralized solutions was in the past the all-pervasive and excessively reductive role played in market-based solutions by just one synthetic information, the price. The advantage of hierarchical solutions was based on the capacity to tackle uncertainty by centrally ordering a multiplicity of information about which actions to follow. Well, the blockchain methodology, by allowing solutions based on decentralized protocols, removes the friction and costs of current intermediaries, makes it possible to develop distributed and transparent systems where empowerment can be shared, asymmetries can be balanced, qualitative aspects can be taken into account. So what is the potential of blockchains as social technologies? Blockchains are technical solutions that facilitate the smooth functioning of an ecosystem by managing and implementing decision-making through automated consensus, creating incentives that nudge participants into behaving constructively, generating trust and transparency. By enacting decentralized information system with inherent data integrity, blockchains constitute strong anti-corruption tools and feature as relational software, enabling new trust mechanisms capable of transforming social relations, reducing transaction costs. There are close similarities between blockchains and bureaucracies. If you think of bureaucracies as a model described also this about a century ago by Max Weber, the classical model of bureaucracy. Though bureaucracies are centralized and blockchains are distributed, but both are defined by the rules and execute predetermined rules. Both work as information processing machines. Both work as trust machines. So bureaucracies are natural candidates to have centralization being replaced by federated blockchain systems. And sustainable growth implies doing more with existing resources and extracting more resources to expand the scale of operation. Blockchains reduce costs and increase the flow of funds, helping social innovation organizations to scale up by enabling marketplaces and the issuance of alternative currencies and tokens. So how can blockchains translate into innovative social policies? Social protection systems are a fundamental element of pride for EU countries, though differing between what we call the Bismarckian and the Bavarian models, including also some Mediterranean varieties in this, and experiments combining both approaches. Traditionally, the welfare state are characterized as mainly exerting a piggy bank or a Robin Hood role. The piggy bank role consisting in helping people to ensure against social risk and redistribute resources over the life cycle, and the Robin Hood role entailing measures to reduce social exclusion by redistributing income and wealth. This varying mix is translating into a combination of 4 functions: regulatory, redistributive, insurance, and production. Historically, these functions have been largely centralized, but could be all reorganized in different manners, for instance, as personal welfare accounts operating in blockchain-regulated social markets where beneficiaries could have incentives to check that the universal but not unlimited coverage is responsibly guaranteed by public agencies and private organizations, play a role in changing the market through informed decision and collective actions. So taking into account this complex background, how can we think of blockchains translating into opportunities for healthcare? Blockchains reside at the nexus of several disciplines, which are key for providing healthcare solutions: cryptography, game theory, tokenomics, network theory. There is a huge potential for employing cryptographic and algorithmic methods to record and synchronize health data transactions across distributed networks in an immutable manner, using smart contracts as coded instructions which execute on the occurrence of an event and extend the functionality of blockchains from storing transactions to performing computations, developing multi-sided platforms where data providers, being both clinical institutions and individuals, researchers and industries, can all rely on data integrity and security and mutually reinforced network effects, allowing to manage data flows and usage based on individual free choice and self-determination, making dynamic data portability in real time possible for individuals and companies, along with various compensation models. Applying health big data to artificial intelligence and machine learning for medical knowledge discovery. So on this basis, what are the fundamental architectural features of a blockchain being applied in healthcare? From our experience, what we've seen, a private permission blockchain is the solution, but we will have more detailed elements afterwards by Ludovica. And a private permission blockchain recording all transactions related to off-chain data stored by multiple hospital repositories and by individuals. Off-chain because the data can be as much as possible. Blockchain has an overhead, has complications in functioning, so it is better to concentrate the blockchain function on recording all the transactions, but have the data storage in an off-chain solution. Metadata, off-chain and the data should be stored by multiple hospital repositories and by individuals. Then there is the need of a metadata catalog allowing to safely inspect what health data are available. The possibility of making use of smart contracts for automatically checking the needed consent and enacting the permission transactions. Privacy enhancing technologies for assuring GDPR compliance and advanced ways of handling data, and come back to this. And an overall privacy by design and compliance assessment for this system. We have learned some lessons working on blockchains, lessons on data sharing in particular. Because despite much talking on the need to foster data pooling and data sharing, there are significant hurdles and constraints in doing so in healthcare. There is a discrepancy in the way anonymization is referred to in the GDPR and by the European Data Protection Board. For the GDPR, anonymization is something which is highly unlikely to allow re-identification. For the European Data Protection Board, it must absolutely guarantee that there is no possibility of re-identification. So the subsequent regulatory uncertainty makes it difficult to obtain anonymized data from clinical institutions. And pseudonymized data, which are within, well, while anonymized data can operate outside of the GDPR, pseudonymized data are within the scope of GDPR, but they require in principle a specific legal ground, such as an explicit personal consent or personal notification for being shared with third parties. And this is, of course, cumbersome and complicated. So big data and artificial intelligence remain difficult to apply at scale in medicine, given that effective data sharing is still the exception in healthcare. We have seen two ways of responding to this, two key modalities. One is called the visiting mode, bringing the algorithms to the data, by which secure computation, which permits running artificial intelligence without disclosing neither data nor algorithms, are performed in the experience we've seen in other projects through a variety of tools like homomorphic encryption, secure multi-party computation, and federated deep learning, also with possibility of having an untrusted black box. But there is a further lesson learned about this. There's visiting mode, and more generally, privacy-preserving machine learning is indeed an emerging field in data science. As yet, however, the foundation of either homomorphic encryption or secure multi-party computation still implies a large communication and computation overhead, which makes it hard to use where very large amounts of data are required, since communication and computation costs are greatly affected by the increase of the number of involved parties or of the model's complexity. An alternative is having recourse to synthetic data. Synthetic data are fully artificial data which achieve anonymity by breaking the link between private information and data's information content. They are automatically generated by making use of generative adversarial networks, the so-called GANs, which are based on two models playing recursively against each other. One is a generator and one is a discriminator, and once the discriminator cannot anymore discriminate if the generator has produced something new or so, or original data, then it means that it has perfectly functioned. And so you have generated high quality synthetic data that closely resemble the real data and are a suitable substitute for processing and analysis. In the United States, the National Institute of Standards and Technology has launched a differential privacy synthetic data challenge in 2019, because differential privacy provides an until now lacking mathematical foundation to privacy definition. Differential private synthetic data generation is a mathematical theory and set of computational techniques that provide a method of de-identifying data sets under the restriction of a quantifiable label of privacy loss. It is a rapidly growing field in computer science. This was what was said by the challenge. It's interesting that this was launched by the National Institute of Standards and Technology. And if we look at what happens now, very, very recently, the Big Data Value Association, which is a large private-public partnership launched by the European Commission, has issued a white paper on artificial intelligence and healthcare, where it is stated that many researchers find unclear the approaches that are required to collect anonymized data to ensure final users' privacy. Generative adversarial networks can generate meaningful synthetic data which do not suffer from the confidentiality constraints of the source data, and EU-funded projects are encouraged to make available synthetic data sets that sufficiently resemble source data while avoiding privacy issues. Generative adversarial networks have demonstrating potential, but a general applicability has not yet been established. So this is an interesting development. This white paper came out just now in November 2020. And so this brings me to my conclusion that the time is ripe for initiatives that fill the void of legal and technical definitions and ease the difficulties of coping with health data sharing while fully implementing the General Data Protection Regulation. Initiatives prompting private and institutional centers to work on the potential of synthetic data and secure computation systems with the aim of suggesting a roadmap for the further implementation and market adoption could be a stepping stone to activate a thriving digital ecosystem for the biomedical sciences. So these are some of the lessons that we've learned working on blockchains and seeing the background conditions for making them work. We can have question and answers now, but perhaps I think it's more productive to have first all the three presentations and then question and answers at the very end. So if this is all right with the attendees, I will stop here and stop sharing and have Ludovica as presenter.
Okay, let's see if I can.
Yeah.
Are you seeing my screen?
We do, but you must make it now full screen. Yes.
Okay.
Excellent.
Good. Very good. Okay. Hi, everybody. I don't even know if we have to say good morning, good evening. It's really a global moment anyway. So maybe on this perspective, it's not that bad. So the aim of this short presentation is to recall the main legal and regulatory issues that we already discussed more than 1 year ago in Helsinki, when we had a very good presentation, very interesting presentation, very in-depth presentation by our friend and colleague Lorenzo Cristofaro from Panette Associati Legal Firm. And I'd like to recall some of the main points that were discussed there, because of course, when we talk about blockchain, as we talk about processing personal data, as Edwin was mentioning before, we need to refer to, in general, legal frameworks related to personal data processing. But of course, we have now a kind of global standard, which is challenging not only Europe, but also all third countries who are relating to data sharing with Europe, and is the standard set in the General Data Protection Regulation. One of the bases of the General Data Protection Regulation is the principle of accountability, which can somehow be regarded as a golden rule. And in fact, this rule means that a data controller must be able to demonstrate compliance with the obligation imposed by the GDPR. And in particular, there are some principles which are general principles already stated somehow in previous regulations, not only in Europe, but also by other international standards, which need to be implemented and followed. So we talk about lawfulness and fairness and transparency of the processing. We talk about purpose limitation. We talk about data minimization. We talk about accuracy, storage limitation, integrity, and confidentiality. We're not going through each of these principles, but all those who work with legal framework and security measures know that each of these principles implies a lot of things to care of in the way data are processed. But one of the main points stated, and maybe of the novelties stated in the GDPR, is the data protection impact assessment. This is a tool and a mean to show accountability is provided. And it specifically is important when we talk about new technologies and new services that need to be brought to the market, or when we implement new methods and productions or services. Because the protection of personal data, this is the true meaning of the General Data Protection Regulation, needs to be followed not only as a bureaucratic formality, but as a structural phase of an innovation process. And of course, it goes along with the other traditional ones, but the point is the overall assessment of the innovation sustainability. So especially if we are talking about new technologies, and this is the case of blockchain, of course, as well as smart contracts, homomorphic encryption, secure multi-party computation, and so on, there is an obligation for those who are the data controllers, so they can be developers, manufacturers, or sellers, to carry out a data protection impact assessment, which aims at identifying the threats that may arise from the underlying data processing activities in order to prevent or at least minimize these risks in order to protect, of course, data subjects' rights. So there are some basic elements of a DPIA, such as a systematic evaluation of the processing operations, of course, with regards to the purposes, and you can recall already the minimization principle, because legitimate interests have to be pursued by the controller. Assessment of the necessity and proportionality of the processing operations in relation to the purposes, and the risk to the rights and freedoms of the persons concerned, the so-called data subjects, as well as an analysis of the measures provided to address the risks, with a specific indication of the safeguards, the security measures, and the mechanism adopted to ensure this protection under the GDPR. This may refer, of course, to the well-known principles of privacy by design and privacy by default, which need to be a general approach, not only if you need to provide a data protection impact assessment, but it is something that is now required in any case of data processing. So on one side, the privacy by design means to take into account the state of the art, the cost of the implementation, and the nature, scope, context, purpose, and risk of the processing. And the privacy by default means that only those personal data which are necessary to achieve the intended purposes are processed in relation, among other elements, to the volume of data collected, the storage, the scope of the processing activities, and the permissions to access the data sets. Of course, we may wonder if a blockchain and a data protection impact assessment are always connected. So if a DPIA is always required for blockchain, there's no rigid rules in applying the legal framework. So of course we need, and the principles of accountability under General Data Protection Regulation means to have a case-by-case approach to solution and to problems. In general, we think anyway that DPIA will be necessary whenever a blockchain system is used to processing of personal data as the very purpose of the system. So if the blockchain is used for anonymized data or for other kind of purposes, maybe a DPIA will not be needed. But in the case the processing of personal data is the very purpose, and this is the case when we talk about, for instance, health data sharing, probably a DPIA will be needed.
Ludovica, maybe you should explain what is a DPIA, so a data protection impact assessment. Probably not everybody knows about it.
This is what I was just saying 1 minute ago.
Okay, okay.
So,
my fault.
Yeah, I hope it was clear, otherwise I can go back to that. But anyway, it's an assessment about the protection of personal data. So where the threats that may arise from the underlying data processing activities have to be identified, and measures to address and prevent or minimize such risks need to be described and carried on. Okay, so under a legal perspective, you already said that there are different kind of blockchain that can be used not only in health systems, but also in many other situations and functions. So we have a public permissionless blockchains, for instance, where anyone is allowed to join the network and become a participating node or a validating node. There are public and permissioned blockchains where anyone can be a participating node and see all data, but only pre-approved actors can become validating nodes and add data to the ledger. And then we have private and permissioned blockchains you were talking about before as one of the blockchains we experimented, where validating nodes and participating nodes must be pre-approved by a governance of actors, generally in the form of a consortium of companies or government agencies. And furthermore, in some cases, there are rules in place that define who is able to see what data. So this is the case we were talking before. As a matter of fact, the European Blockchain Observatory and Forum recommended in a report called Blockchain and the GDPR that in case of need to store personal data, it is necessary to rely on private and permissioned blockchain because they seem to be the more GDPR compliant system of blockchain. Of course, also in relation to the kind of personal data which need to be processed. In fact, under the GDPR, we have to take care about different rules to guarantee the lawfulness of the processing. We have a general legal basis to ensure the lawfulness of the processing, where the grounds for the processing can vary. And of course, the first rule is consent, but we can also refer to other lawful bases such as legitimate interest, public interest, contractual necessity, legal obligation, and vital interest. But all these rules, who are general for personal data, need to be considered under another strength, and somehow when we talk about special categories of data. And among these special categories of data, whose processing is prohibited unless specific conditions are satisfied, we find health data. So this is what once under the directive was called sensitive data, and under the General Data Protection Regulation are called special categories of data. So under the health sector, we should consider that this processing should not be allowed except when necessary for specific conditions and on specific legal basis. Among these legal bases and reasons, we find the reasons of public interest in the area of public health, such as protecting against serious cross-border threats to health or ensuring high standards of quality and safety of healthcare and of medicinal products or medical devices, and also for particular professional secrecy. But we also may refer to the processing for archiving purposes in the public interest and for scientific or historical research purposes or statistical purposes, which are also detailed in Article 89 of the GDPR. And here the processing must be proportionate to the aim pursued, and it must respect the essence of the right to data protection and provide for suitable and specific measure to safeguard, of course, the fundamental rights and the interest of the data. This kind of processing allows also the reuse for research purposes. In fact, the GDPR establishes that further processing for scientific research purposes must not be considered to be incompatible with initial purposes, so long as technical and organizational measures have been put in place. So of course, with relation to data minimization, but also strict separation between participants in the research and outside stakeholders. But we have to stricter interpretation when we talk about sensitive data. While on the other side, we have a kind of broad consent relating to research purposes, as data subjects should be allowed to give their consent to certain areas of scientific research when in keeping with recognized ethical standards. The puzzle is also complicated by the fact that even though we have a regulation which should be implemented in the same way in all member states, there are some possible derogations. So many member states are, however, adopting their own laws to implement the GDPR or set new rules in this regulation. And this is a panorama of the data subjects' rights, which need anyhow to be respected and guarantees. There are new rights and more traditional ones. But we also must remember that when we talk about data process for scientific research purposes, union or member state law may provide for additional derogations from the rights referred to above. So subject to the condition and safeguards set forth in Article 89. And in these cases, it could be impossible or seriously impair the achievement of the research. And such derogations are necessary for the fulfillment of the relevant purposes. So there's sometimes a risk of a jeopardization of the situation. But to go to the main theme, which was somehow the relation between GDPR and blockchain. A friend of mine gave me this nice sketch about GDPR aims to regulate the word centralized data control, whereas the aim of blockchain is to challenge it. Of course, there are some concern about the possibility that the rights, data subjects' rights are respected also when using a blockchain environment. In fact, there was in particular the French Data Protection Authority that explicitly revealed the concerns on this regard. And notwithstanding the choice of a private and permission blockchain, which, as we said, could be more in line with the GDPR principles and obligations, there are anyway some unsolved issues at stake. In fact, of course, there is an immutability of the data retained on a blockchain. Nevertheless, compliance with the GDPR has to be ensured by means of technical loopholes with specific reference to some of the rights we had a look before. So in particular, taking care of the rights of erasures, of limitation and rectification. And even in the case where no personal data are registered on the blockchain, nevertheless, actions are to be envisaged in the event of exercise of individual rights to guarantee full accountability. And as Edwin was already mentioning before, there are several risks of non-compliance when processing personal data also in a blockchain environment. He was mentioning before that even if strong encryption is applied on personal data, the result is very likely to prove not fully anonymized, given that as long as the decryption key exists somewhere, the data can still be singled out, leading to what is called a reversed risk. Another risk is that the linkability of encrypted data to an individual can be reached by further examining patterns of usage on context or by comparison to other pieces of information. And anyway, there's a seamless evolution which cryptography technologies and science are subject to. So we were mentioning that such risk can be, for instance, avoided by preventing the registration of any kind of personal or sensitive data on a chain, such in the case of segregated computation or secure sharing model, and thus fulfilling the requirements of privacy and security in accordance with the GDPR. For instance, the encrypted data are stored solely off-chain in an MHMD project in a distributed database. This was a possible solution that we analyzed and went through. And the main characteristic of the MHMD blockchain solution Edwin was mentioning before is that it was private and permission, that there was an off-chain held data retention, that smart contract records the consents expressed by interested parties. It guaranteed the inability to know the parties involved in a transaction, and each participant was solely responsible for the dataset received. And there was an impossibility of hindering the reception of the dataset by the network participant. Another solution that can be explored, especially in the future, is the making use of synthetic data. Also, Edwin was mentioning before, but in general, an approach to find and overcome the frictions between general data protection and blockchain should refer to an analysis on as we said, a case-by-case approach. So start, for instance, with the big picture. How is the value created for the user? How the data is used? And ask yourself, do you really need a blockchain? Then avoid storing personal data on the blockchain, making full use of data obfuscation, encryption, and aggregation techniques to anonymize data if possible. Collect personal data off-chain, or if the blockchain cannot be avoided, on private and permission blockchains, and stay up to date and propose innovative solutions, trying to be as transparent as possible towards users. So this was a quick recall of the main points and issues related to regulatory and some of the legal and regulatory issues related to blockchain in health applications. And this is all from my side.
So shall we pass to the last presenter and then have opened the session for question and answers? You should where's Mirko? Mirko, you should be now presenting. Sharing your screen. Okay. Excellent.
Hello, can you see my screen? Everything is all right?
Yeah.
Okay, so thank you very much and good evening, at least for those who are in Europe. And thank you very much, Edwin and Ludovica, for inviting me to speak about this important, I think, topic of potential usage of blockchain technology for coping, for facing this dramatic pandemic experience we are having all around the world, and how the INTABA, International Association of Trusted Blockchain Application, tried to contribute to the debate and to the implementation of novel solutions using blockchain for coping with COVID-19, which is, I think, bright and very interesting example now of how blockchain can actually be useful, and a very useful technology and an enabling technology for basically addressing this kind of issue, because sorry, I muted myself by mistake. Data sharing is one key element for managing a pandemic. So quickly about the International Association for Trusted Blockchain Application. It's an organization, an international organization made by private companies mostly, but also research institutions and policymakers and regulatory bodies. Actually, it's been it started being funded with the initiative of the European Commission, which actually hosted some of the initial meetings and then became more like independent body, but with a strong connection with the European Commission and a connection, as I'll mention briefly later, with also the European Blockchain Observatory and Forum. And in general, the organization aims at pulling together experience, know-how, and stakeholders using for facilitating the adoption of blockchain in a variety of use cases. This is the reason why the organization is basically it's organized in different working groups, pretty much as RDA. And we have the healthcare working group, for which I act as co-host together with my fellow co-chair, Danny Van Rogen. So I will say quickly something more about the activities in general of the working group later, but now I want to focus on the topic at stake here, which is the COVID-19 pandemic. I just took this few, these two slides, this and the next one, from the WHO website a few minutes ago, as you can see also from the page itself. So we are facing a global pandemic with more than 50 million cases all around the world, and more, unfortunately, more than 1 million deaths all around the world. It's a global pandemic, and it's easy to see from the map that actually no healthcare system is being spared. So basically, all healthcare systems all around the world have been burdened with the management of this pandemic. And of course, also advanced countries with active program of digital health have been suffering very much in the past 6 months in dealing with this pandemic. And at the end of the day, pandemic management is basically and essentially about timely sharing of trusted data between organizations, and which leads to quick intervention to reduce risk of contagion and limit outbreaks where they are identified. So the key point here is sharing data, trusted data between organizations, and coordinate data gathering about from different data sources and also from different institutional stakeholders dealing with this. So it's no wonder that digital health and became a bit more at the center of the key topic, a hot topic at the center of a political agenda all around the world. And many companies, many governments have been experimenting with digital solution, also blockchain-based, DLT-based solution for facilitating data exchange or for facilitating the spread of trustful information about the pandemic. So the importance of health data sharing and management and access became more apparent due to this dramatic situation of the COVID-19 pandemic. These are just few of the more authoritative views in terms of the role of health of digital solution in the management of COVID-19, and also the role specifically that blockchain can actually play here. And many things have been already said by Edwin and Ludovica on that regard. So given this scenario, this context, and I also wanted to the last thing to highlight the work that's been done in RDA as well. And these are the recommendations for and guidelines for data sharing specifically conceived by the COVID-19 working group within RDA, which I found very, very interesting. And again, the key point here is data sharing in a timely and accurate manner. So here, I think the role of blockchain technology is actually quite important. This is the reason why, as I was about to say, INTABA as well, I thought that it would have been very important to start to kick off a task force specifically addressing COVID-19 issues. And this has been done in the past 6 months in cooperation between government, academic participants, and also industry participants, which are all involved in our working group, are members of our working group. So basically, the INTABA task force is combining key players in the global blockchain ecosystem, in particular industry players that can contribute solutions that are quick to be implemented and adopted in real world scenarios. And basically, INTABA proposed itself as an institution to analyze, sort, and present the solution to government asking for help. For example, the Spanish government asked INTABA to come up with some solution for dealing with different challenges, basically posed by the pandemic. At the same time, INTABA also joined the World Economic Forum COVID Action Platform. So what we try to do here is create a common framework for cooperation and for facilitating the spread of know-how, resources, and solution to face the different challenges posed by the pandemic. So on these premises, the healthcare working group basically in INTABA gathered a number of different solutions and proposals by industrial private partners involved in the working group. And we had a variety of solutions that is being presented. And this is just really, I would not dig into any of the specifics of the proposed solution here, but just to highlight how many and different solutions have been proposed for coping with different aspects, basically, of the COVID-19 pandemic, from digital identity systems to secure health record sharing for provenance, integrity, proof, which is again a very important element in a pandemic situation. Also, of course, providing verifiable test results so that people can have a sort of a COVID-19 passport. And many of the solutions proposed were articulated around this proposition. And of course, also clinical trial data integrity was deemed an interesting thing to provide, in particular when we have to accelerate dramatically the creation of new vaccines specific for the COVID-19 disease. So there is a need of making the whole process more efficient and transparent. At the same time, the blockchain solution presented by at the INTABA working group were also focusing on other aspects, such as the management of resources from government or from private investors to cope with the financial crisis, which has been caused by the pandemic. So, for example, traceability of financial aid, in-kind donation, and relevant social impact also was one of the solutions that the COVID-19 task force received from their members. At the same time, a whole ecosystem for managing subsidy program was proposed, again in the working group. And finally, but not less important, ideas for tackling misinformation, which is also causing very important damages to the healthcare systems all around the world, because people need to cooperate, of course, to managing properly the pandemic. And when this doesn't happen because of fake news circulating in social media and so on and so forth, this is a very, very serious issue to be sorted out. So lastly, I will, sorry, I'm having issue with my computer and I don't know what's happening. Oh, okay, sorry. Okay. That went too far. Just 1 second. Yeah. So now, just few things, and I will be concluding my quick presentation about the healthcare working group objectives in more in wide objectives of the working group beside COVID-19. I will mention this because I think there are interesting opportunities for cooperation between RDA and the specific working group in blockchain and for healthcare data and the INTABA working group. We are basically focusing our activities around 3 specific elements. One is mapping the blockchain landscape in the healthcare sector to understand who are the provider of solution, what kind of use cases are actually more mature to be deployed, and what is also the collective, awareness of end users and customers in regard to blockchain-based solutions, which usually it's not ideal. There's a lack of awareness about who is providing blockchain-based solutions and what kind of solutions are actually available in the market. And another thing we want to focus on is structurally engage with relevant bodies and government. This is important in particular in terms of regulatory issues that needs to be sorted out to facilitate widespread adoption of blockchain-based solution, as has been quite extensively addressed already by Ludovica. And finally, establishing a bidirectional learning process with end users, because that's another very important thing to make the healthcare community aware of what a blockchain-based solution can offer, but also to better understand what are the real needs and real use cases that we need to address at the industry level. This I said already, some of these elements, again, enhance clarity on legislative and regulatory landscape, and also on the needs and use cases that are needed, that are more pressing in the healthcare domain. We have established a cooperation with European Blockchain Observatory Forum. We try and contribute and cooperate with them in the drafting of a forthcoming report on blockchain and healthcare, which should be published at the beginning of next year. And I wanted to conclude with a sort of a call of action a call for cooperation between INTABA and RDA, or the working group specifically working on blockchain and healthcare, for organization of roundtables, something that we are already doing in for different topics. Clinical trial is one of them, of course, and we will be organizing other in the next few months. And also, of course, for COVID-19, for cooperating in the discussion and in understanding how to cope better with the COVID-19 pandemic. So that will be all from my side, and thank you very much.
Thank you, Mirko. Yes, we shall certainly consider the possibility of having a convergence of our working group here, which comes to an end anyway at the latest with next plenary session, and the INTABA, which is an ongoing activity which has just started recently, but is covering very much the same area and with great promises. So these were the presentations for this strange virtual meeting at the time of COVID. Now the floor is open for comments, questions.
Yes, I just read Matthew's reflection. It's not just a question, but more his consideration about the emphasis we put on the GDPR, and of course, blockchain application in health have a worldwide application, not EU only. As Edwin briefly replied, of course, Europe is a big partner in healthcare, and GDPR puts a lot of strict constraints. It's at the moment the highest data protection standard. But also we are facing at the moment that a lot of other countries are implementing new data protection regulation, and they're looking at the GDPR as a regulation and a standard to refer to. So I heard and I read that just a few days ago, I think California just approved the data protection regulation for California, which seemed to be referring a lot on GDPR, but also Brazil and other countries outside Europe are developing their data protection regulations and legal frameworks, taking into account what is going on in Europe and the standards set in the GDPR. So even though blockchain is not really only a matter of data protection, but it also refers to other kind of rules and legal frameworks we should talk about. I'm not an expert of that, but of course, smart contracts and other responsibilities and a legal obligation in civil, commercial law and other sector of legal issues. Nevertheless, every time protection and data processing of personal data is concerned, we'll need to be aware of some of the issues and constraints coming from the GDPR, and that's why as we are more dealing, of course, with this kind of subject, we thought it was anyway interesting to share it. But maybe if you are suggesting or recommending that a wider overlook should be given or explored within this group or in other steps following this working group, we can talk about it and consider it, of course, is a good option and an important one as well. So I just wanted to make a brief comment on that.
Yes, thank you. I think your approach is very pragmatic, and I completely understand why you're doing it. Given the constraints, it would be very interesting also to examine the other legislations around the world. But of course, we have limited work time to do this, of course.
One additional consideration is the fact that, as I mentioned, the intangible economy has developed very strong economies of scale based on the non-rivalry of digital goods. And this has brought to a market configuration which is very much concentrated with oligopolies, if not really just monopolies on a planetary level. So in this sense, the GDPR is interesting because it introduces a stronger protection for persons, for personal rights, and for personal data. And this is why we think that it can be a good basis, even though blockchain has come after the preparation of the GDPR and was not configured there. But the general background of the legal framework of the GDPR is probably combining some elements which reinforce the possibility of having a non-constant, a non-hierarchical, non-monopolistic, but a distributed approach like the blockchain favors technologically. And in this sense, there are elements to be discussed, so which go for further steps. Will there be an ownership of the data? For the time being, there is no ownership of the data. Just people who deal with the data can be clinical institutions or private companies or individuals, but there is no general scheme for this. So that's why I was focusing, but very quickly because there were so many points, and I just focus on what I consider the most significant ones, on the fact that possibly, since the only way now for operating outside of the GDPR is to have anonymous data, The real strong approach to anonymous data is based on synthetic data, in my view, because then you really have artificial data, and you can have, we've added the differential privacy, a strong, robust, very robust system for having this privacy protection with totally new artificial data and therefore anonymous data. And on the other hand, if you want to work with pseudonymous data, for the time being, there is the approach of having secure computation on the data without letting the, people access the data. Or you must have more consent, more things, but then these would imply a system based on data ownership, which for the moment we don't have. We don't have property rights in digital goods. We have excludability conditions temporarily, but we don't have property rights really. So this is a global general framework which needs to be understood more deeply, but I think this is conducive to innovative solutions. That's why I think there is a deepened connection between blockchain openings and the advanced general data protection regulation which GDPR has introduced, which goes beyond what was developed beforehand with the HIPAA system in the United States. Matthew, you've also asked about INTABA and the use cases. Maybe Mirko would like to answer on this, because in fact he was one working in our working group on the use cases. Have you seen the chat, Mirko?
Yeah. Of course. Just to kind of clarify what was the INTABA approach at the beginning and what it has become afterward. At the beginning, we made basically a call for action for industrial partners. So they come up with a number of solutions for addressing different issues. And I will mention again, digital identities were proposed specifically for the management of the pandemic, or verifiable test results, again, or clinical trial data. But that was not actually something that came from the end users, but mostly from the industrial partners that were maybe having some sort of ready-made solution that was adapted to the COVID-19 situation. Then INTABA changed basically the approach and asked for end users, basically government, to clarify the use cases, and this will be the basis for further action on this regard. At the same time, the working group is working for the identification of use cases for the pandemic management, but also in general, again, making a sort of analysis of the landscape in the healthcare domain, so to understand what are the most interesting or more robust or more compelling use cases from the end user point of view. And we are producing a report which will be hopefully published by the beginning of the next year. And we are also planning to make a publication, a peer-reviewed journal on this. But this is work that's ongoing right now in the working group. We have bi-weekly calls. We have many industry members that wants to contribute on this, and they have open source solution, which is also a very interesting thing to be applied to different use cases. Some of them, in particular, in community-based care, which I think are also relevant for pandemic management. But this INTABA the working group will come up with a comprehensive report on this regard, hopefully in the next few months. So if you're interested, just drop me a line, and I'll be happy to keep you updated.
I certainly are interested. I mean, just to clarify, I come from EGI Foundation, which coordinates an international research infrastructure, and I lead service delivery. So I've got very much my foot in the camp of dealing with real life solutions that researchers and scientists are facing. And that's why during your presentation of INTABA's work, it kind of rang alarm bells with me when you said that you're asking the industrial partners for their solutions without actually first saying what the problem is, because if you do that, you'll immediately have lots of SMEs, companies, open source producers coming up with what they believe to be their greatest solutions without actually saying, well, what is the problem that we would like to tackle first? What are the pains that the researchers are facing now that we need to help them with by presenting these new innovative solutions?
That's exactly why INTABA switched approach from industry-driven to an end-user-driven. Truth to be told, the government partners have been less responsive and less keen than the industry partner is sharing their needs and their pain points. Of course, it's easier for SMEs to produce their fantastic solution. Maybe it doesn't sort out any issue at all. But government are more timid, if you will, in sharing issues that they are actually facing in managing the pandemic in different kind of areas. So we found that it's in principle actually more correct to ask the end user first, in particular of national health services, to come up with their pain points. But we see that in practice, it's more difficult for them to contribute this kind of feedback. Maybe it's also because they are facing the emergency and they are trying to sort out this in a day-by-day fashion, if you will. But we are still confident that actually, if we manage to communicate the mission of these activities properly to government and national health services, we should come up with actual and well-identified pain points and needs that will be ready to address with the industrial partners we have.
May I ask one final question?
Sure.
The question here is relating to COVID-19. Do you believe that there are new problems that are being faced that have not been faced with previous pandemics, with previous pressures on national health services that could uniquely be helped by blockchain technologies?
I can make it's my personal opinion, of course. I think that what we experienced in terms of widespread, I mean, the fact that the COVID-19 was different because they really reached millions of people so quickly and took national health services so off guard that actually advanced and efficient system for data sharing at multi-level governance, governance way of sharing data. This was something that in COVID-19 in particular, I think was missing. And I think that if we had appropriate data sharing systems, also engaging with citizens, because this is very important. And here I think the blockchain-based solution can have a role. So if we had system involving already patients and citizens, allowing them to manage their own data, having trust that the data is accessed for a certain purpose, and they can actually decide who and when access the data, and it's transparent. The whole data life cycle is transparent. And then you have a quick way of gathering data from different data sources, and quick enough to be, I mean, in response to how quick the contagious went with COVID-19, or how quick it's going right now. This, I think, is unique of COVID-19 and was not experienced in the past. But this is my personal opinion. So I think that if we had this sort of solution now, this would have been helping a lot actually in managing the pandemic.
But as I understand, blockchain is not necessarily dealing with data access, but it's more efficient transactions. But this may be my misconception.
Well, I think that another point of view can be that for the moment, the dealing with the pandemic has been based on on the fact of having lockdowns, on blocking everything, on people, on asking everybody to not move, to interrupt what they were doing, to not see people and so on. So this has been a way of handling, and not criticizing it, but perhaps there is a limitation because it could be reversed. And there the blockchain could be useful in indicating why a specific person can move, can do things, because there is a test which has been done, which clarifies that that person is not bringing a blockchain, COVID around, because and so the blockchain could be a way of having these tests guaranteed from the point of view of those who want to move, who don't want to exit from the lockout. So reverting the approach, it is a bit like having the empowerment of citizens, as Mirko was saying. But it should be, things should be thought in that direction, so that then you could have transactions on the data, etc. But the main thing in this case would be the fact that you can have, in a very safe and immutable way, the guarantee that once you do something, you do it because you have a very recent test proving that you are not at all carrying around the disease, and so you can be more proactive than otherwise would be allowed in a lockdown approach. I think that something in this direction should be thought of, and possibly there would be a role for blockchain in this.
Well, I think that just to complement on what Edwin was just saying, is that, of course, provenance, proof of provenance, proof of integrity of data, so certification and this traceability features that blockchains offer is both about facilitating sharing of trusted data and empowering citizens with by certifying the fact that some data, even from private, for example, if I go to a private institution to make an exam to prove that I do not have actually COVID, and then that data can be certified, and the provenance can be certified, the integrity can be certified, so that that data can be accepted at the public level. For example, in Italy, it happens actually in my region is now in complete lockdown. And if you go to a private institution to have examination that proves you do not have COVID, the public institution will not accept it as a proof to allow you around. And this is mainly because they don't trust the source of the data. And that can be actually one another use case for blockchain, a blockchain-based approach for data sharing and certification and a proof of provenance and integrity. So this, I think it's more transversal, and it's. But I agree with you, Machi, that actually we should start from the use cases first, definitely. And I think this that I just mentioned is one of those.
We just have a few minutes left, so I would like to ask the other attendants if they have questions. They've been silent. Otherwise, maybe Isabel could just tell us in a few words, what happened with the continuation of the very interesting Atelier blockchain, which she opened in the French RDA section. Isabel, do you hear me? Maybe not. Laura? Bianca? We don't have many attendants.
Hi, it's Laura. I thought it was incredibly interesting. I don't have much to add other than really listening to the discussion. And I think the thing that sort of stands out to me is the barriers that exist and how to overcome them, particularly your discussion in COVID. And I just was also at the same time getting influenced by a vaccine that might be 90%. But I think if we don't have access to large data sets, and I absolutely, I have a doctorate in social work, I understand the human aspect and IRB and the difficulty, but I wish if there is an algorithm that can capture and satisfy the barriers, this would be enormous for, I think, implication for, future healthcare, particularly, the public health realm.
Thank you. Well, this means solving some of the issues by which now we don't really are able of using at full speed, at full power, potential artificial intelligence, machine learning, and these things in healthcare, because in fact the data are siloed, they are not easily shared, they have complications, and so on and so forth, or they are shared without guarantees for the personal data and the persons involved. So this is still a complicated area where the new regulation coming up in California right now, and in Europe 2 years ago, and in other places, because the GDPR approach has been followed by, as Ludovica was saying, by a number of other countries, also Japan. Well, this approach will probably lead to a new area where the rights of people are better defined and allow for different outcomes than what we've just seen otherwise in the dramatic increase in economies of scale and in profits, but at the detriment of the fact that others don't receive anything out of this and are not in control.
Yeah. So
the point of having a healthcare system which is more decentralized and in control of the people is something which goes probably together with the growing importance of blockchain.
Unfortunately, I mean, COVID is horrible for everyone and is not saying anything positive, but the one light is it's an equalizer around the haves and the have-nots on some level. I hate to add that into the mix, but I think there's also proprietary pieces around data and research where people have withheld information for the purpose of economic advantage. And I think that COVID has taught us that isn't really, or hopefully is teaching us that, none of us are above that, and public health has to be a primary issue for us globally. So it's just, it's a dilemma, and I understand it around people's privacy. I was very involved in the public health effort around HIV in the Boston area when I was there. And there was the same issue that came up around names reporting per state versus a national effort, because you didn't want to out someone because it was such a horrible, there was such a horrible backlash. And at the same time, you couldn't treat folks in some ways without being able to track and trace. So, there was number reporting and all this kind of stuff, but it was a huge challenge, particularly in Massachusetts, is seen as a very liberal state and didn't go along with the push from federal government to do names reporting, which I agree with. I think you can tag people in other ways, but I think this plays out here as well.
But what we need is the development of an ecosystem where, in fact, people can interact positively and develop solutions, and stop having just this being top-down from somebody who has got a brilliant idea, starts with an innovation, but then controls everything, and this is not a satisfactory solution for the type of problems we have. And I think that COVID is a very powerful reminder that we need to think of different approaches.
Yeah, I agree.
Thank you.
Thank you. This was extremely useful and helpful and necessary.
So last minute, Bianca or Isabella, are you around?
I don't have any questions, but it was really insightful. Thank you.
Thank you. Okay, so I think we've had, well, we just 1 minute, one last minute. Anybody who wants to add something before we disappear in this virtual meeting?
I just want to thank you for joining our session, and we'll keep you updated about what's going on. We were supposed to end the working group activities. We are running after our 18th month, but because of all these delays, maybe we'll have an extra meeting, I don't know. So in case we will update in the next plenary, maybe in Edinburgh or virtually, I don't know.
Well, hopefully physically in a real meeting, and that will be the possibility of bringing to an end this working group. Thank you so much.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.
Bye-bye.